the findings of the landscape analysis of the national regulatory frameworks to protect breastfeeding in Sri Lanka. So just to highlight a few points, we just heard from Dr. Hiranya about some of the newer developments, about the recent gazetted notification, and also about the different circulars that were issued by the Ministry of Health. So this exercise is a very simple exercise that was undertaken to review the Sri Lanka code. So it is limited to the legal provisions that exist in the country, and it is only a critique of those provisions and does not take into account the other developments that have currently happened. However, it is important to know where we are as a country in terms of our legal provisions to protect breastfeeding. I'll not repeat some of these because Dr. Hiranya has already covered. Just to highlight that the international code talks about the minimum requirements that are required to be followed by every country for regulating the marketing of these products. And we are extremely concerned about the aggressive and the inappropriate marketing followed by these companies that the code aims to restrict. So what was done? So again, it's a busy slide, but many of these points have already been covered. I'll only speak about what was done. So there was a desk review that was undertaken of the Sri Lanka code by the Regional Office of UNICEF and global expert. And these were reviewed together with the Sri Lanka team and also validated at a workshop in Colombo. So what was done? The code was reviewed against, the code in Sri Lanka was reviewed against the national code to see how, to what extent the Sri Lanka law complies with the international standard and recommendations in the code. And this was done across the 7 areas that were identified in the code. As you can see, different scores were provided to each of these areas depending upon to what extent the provisions comply with the international regulations. And then based on the total score, countries were grouped to and identified to be either substantially aligning with the code or moderately aligning with the code, or only where some provisions were aligned, or some countries didn't even have any legal provisions. So I'll, in the next few slides, share the findings of this assessment. But before that, just to caution that this exercise of scoring a law can be tricky, right? Because law is a very complex kind of a mechanism. So there were certain generalizations and simplification that was done when this scoring was done. And secondly, also we could not score all parameters. So only some critical parameters were used to compose these scores. So those were some of the limitations. And as I already mentioned, this is limited to the Sri Lanka code, the legal provisions. It does not take into account the circulars that were later issued, and also doesn't take into account the more recent gazetted notification on the advertising marketing. So this was done as an exercise for all countries of the South Asia region, which composes 8 countries. Bhutan, one of the country, did not have any legal provisions, it just had a guideline. So that was not considered. And you can see from the scores, Sri Lanka scores 69. So it is identified as to moderately align with the code. So let's look at this a little more closely. And across all the different 7 parameters for scoring against the code, we have seen the different scores that we have got on each of the areas. Let's look at each of them very briefly. And again, to highlight what I'll be sharing now is I'll be focusing on what is missing, right? So there are many things that already the Sri Lanka code is aligned to the international code, but those, in the interest of time, I will not discuss and repeat, but only highlight what is missing. So let's first look at the scope of what is covered. I think Dr. Hiranya already mentioned, right? So the code in Sri Lanka was limited to age 12 months, whereas international code talks about covering the age up till 3 years of age. Now, this has already been addressed because of the updated guideline that Dr. Hiranya mentioned. However, what happens is when we have the code limited to 12 months, many other products, follow-up formula, toddlers' milks, etc., all of them get our companies are able to promote it, and there is a tendency to cross-promote products, right? So this is something that we need to be especially careful about. Then around monitoring and enforcement. So while the code in Sri Lanka identifies the ministry in charge for monitoring and also recommends regular committee meetings to review any violations that happen. However, the powers of the committee to investigate and prosecute are not specified in the code. The composition of the committee is not specified in the code. And the requirement that this monitoring and enforcement should be independent and transparent and free from commercial interest, that is not specified. And neither are the sanctions in case there are violations that are identified. So these are all some of the observations, but also these are clear recommendations for us in terms of what we need to do to strengthen the code further. Related to information education materials on infant young child feeding, what is expected is that while the formula products need to be available, right? So there will be some women who will require these when they are properly assessed and indicated. In those situations, appropriate communication has to be accompanied with that. And it is important that the code specifies what those information or communication should be about. An example, that when formula is prescribed or required, then it should be accompanied by a warning that there is a risk of contamination of the powdered milk that happens. And in the Sri Lanka code, we do refer that the manufacturers or the companies, they do not do communication or they do not communicate about the product, but this seems to be an absolute recommendation, which means that they should not communicate about anything, whereas we would want them to communicate about the risks of using formula. So that is something that our code needs to incorporate. Again, this has already been spoken about. Promotion to general public, we have scored full, but clearly because the coverage was up till 12 months, it led to continued promotion of the other products and the risk of cross promotion remained. Promotion in healthcare facilities, again, we have scored quite well. The only suggestion for further improvement could be to prohibit companies to use facilities to host events, contests, or campaigns. This specifically has not been adequately addressed. And engagement with health workers and systems, I think some of these provisions were not part of the code. They are, of course, I am aware that in the subsequent circulars by the ministry, many of these points have been addressed. However, it is important that in the legal provision as well, these points are specifically mentioned and highlighted. And finally, on labeling, extremely important that the claims, health and nutrition claims made by the companies on the labels should be prohibited. Now, these are all the findings that I wanted to share. Just to highlight that the code is an enabling tool for all of us to ensure that compliance to these by the companies is ensured, and that we are in a position to be able to promote, support, and protect breastfeeding. And also to say that just having the code as a legal provision alone may not suffice. We would need the commitment from all of you, all of us who are here in this room, to ensure that this code is enforced and that we continue to maintain the very high and levels of breastfeeding that we have achieved as a country, and that we do not fall back in the coming time despite the crisis and the challenges that the country is facing. So I think a lot of many partners have helped in ensuring that this analysis is available for us to take this initiative forward, and I thank all of you for this.